as amended be agreed to. I call the member for Ryan.
Thank you, Mr Deputy Speaker. I'm pleased to have the opportunity to contribute to this very important debate, and I commend the member for Dobell for bringing this motion to the attention of the House. Bowel cancer is a disease that kills more people than prostate cancer and kills more people than breast cancer. It affects women and men almost equally and is second only to lung cancer among cancer killers in Australia. 77 Australians lose their lives to bowel cancer every week. Mr Deputy Speaker, many Australians would be surprised by these figures because, in my experience, bowel cancer is not a disease that is as widely understood by Australians as some other cancers. So it is appropriate that Bowel Cancer Australia has designated June as Bowel Cancer Awareness Month for 2015. The facts are confronting. 1 in 12 people will develop bowel cancer in their lifetime. 15,000 people are diagnosed each year, and is a cancer that does not strike the elderly. 1,000 of these diagnoses are for people under the age of 50. However, there is some good news. 90% of bowel cancer cases can be treated successfully if found early. But herein lies the problem. Bowel cancer is detected early in fewer than 40% of all cases. So the solution is clear. We need to do more to raise awareness and to educate Australians about the symptoms of bowel cancer. According to Bowel Cancer Australia, symptoms can include blood in the bowel movement, unexplained weight loss, persistent change in bowel habit, and severe abdominal pain. Bowel Cancer Australia recommends that people suffering from any of these symptoms should see their general practitioner. This month is all about awareness. Thankfully, experts do understand many of the risk factors that can explain the onset of bowel cancer and can therefore recommend a range of simple, common-sense lifestyle changes that can reduce the risk of developing bowel cancer by up to 75%. For instance, there is evidence that higher levels of physical activity protect against colon cancer. Bowel Cancer Australia recommends at least 30 minutes of moderate intensity physical activity on most, if not all days. 60 minutes per day is preferable. Maintenance of a healthy body weight is also important. In terms of diet, there is evidence that consumption of garlic, milk and calcium, not altogether, probably also protects against bowel cancer, as does a focus on high fibre foods, including whole grain cereals, nuts, seeds and beans. Further evidence, albeit weaker, also suggests a link between the consumption of non-starchy vegetables, fruits or foods containing vitamin D and a reduced incidence of bowel cancer. Bowel Cancer Australia recommends consumption of at least 5 servings of non-starchy fruits and vegetables every day. It is also recommended that alcoholic drinks should be limited to no more than 2 drinks a day for men and 1 drink a day for women, with 2 alcohol-free days a week. And, as is the case with many other cancers, smoking is a risk factor for developing of bowel cancer. Studies have shown that the smoking of 40 cigarettes a day increases the risk of bowel cancer by 38%. Risk factors we cannot avoid include family history. For around 25% of all bowel cancer cases, there is a family history or hereditary contribution. It is therefore important for people with a family history of bowel cancer to pay particular attention to the symptoms and to make the lifestyle decisions necessary to minimise risk. Age is also a risk factor. Bowel cancer risk increases with age, so for people over 50, Bowel Cancer Australia recommends undertaking a screening every 1 to 2 years. The National Bowel Cancer Screening Program offers free screening for people aged 50, 55, 60 and 65. As part of Bowel Cancer Awareness Month this Wednesday, the 17th of June, is Red Apple Day. On Wednesday, Australians are encouraged to wear a green and red bowel cancer awareness ribbon and host apple-themed fundraisers. For those who want to get involved, information is available at bowelcancerawarenessmonth.org. There are details on the website to assist individuals, workplaces, patients, healthcare professionals and schools to all get involved. Bowel cancer is a disease that can be prevented in many cases and, if detected early, can be treated effectively. But the first step is awareness, and I commend Bowel Cancer Australia for all the work they are doing to make Australians more aware of the symptoms, risk factors, screenings and treatments available for bowel cancer. I commend the motion to the House.